day to everyone. I'm Zuela Abutan, a second-year nursing student under Section A5. Now I'll be demonstrating the female catheterization, so I hope that you'll listen till the end of the video. Now, before the catheter insertion, we have to prepare the patient, and there are a lot of things to follow with that. First is we have to verify the order. In verifying the order, we have to check the MAR, or the medical administration record of the patient, take a look at it, and make sure that we will be administering the medication effectively. Next is we have to prepare the materials needed, which are the catheterization kit, urine bag, sterile forceps, iodine solution, alcohol pads as an alternative for soap towelette, syringe, cotton balls, the drape, underpad, sterile gloves, and lastly is the petroleum jelly as an alternative for lubricant. The next is we have to identify the patient. We have to explain the procedure and ask for iodine allergies. So, hi sir, good morning. Can I have your name please?
Andre Rodriguez.
Okay, how about your birthday?
December 8, 2001.
Okay. Hi sir, Rodriguez, I am Zuela, your nurse for today, and I will be doing catheterization. So, sir, for your information, this is a procedure where a tube will be inserted in your penis. So, this may be a little bit uncomfortable for you, but this serves a purpose for your urine to drain in your bladder. Okay? So, sir, before we proceed, may I ask if you have any iodine allergies?
No.
Not. Okay. That's good to know if you don't have any. Thank you. The next is we have to make sure the patient's privacy as well as the room's good lighting. Then here we have to position the patient correctly as we assist him in a supine position where legs are extended and slightly apart. Next is we have to make sure that we perform hand hygiene, done with our clean gloves, and then afterwards is we have to cleanse the patient's penis with soap and water, then rinse and dry it afterwards. Okay, now since we are done in cleaning our patient's penis, we have to remove our gloves. And then we have to make sure that we perform hand hygiene. Since our gloves is already contaminated and is exposed, it is necessary for us to replace it with a new sterile one. So now I already have my sterile gloves on. Next is we have to drape the patient. So I have here my underpad. We have to pick this one and place it under the patient's buttocks. Can you raise your hips, please? Thank you. Now next is we have to pick our fenestrated drape and place it over the patient's penis. Now next, in preparing our materials, we have to first prepare our antiseptic solution here, and using our cotton swabs or our iodine solution, which is the betadine, we have to get it with our sterile forceps.
Then attach the saline-filled syringe to the side port of the catheter. And afterwards is to inflate the balloon and leave the syringe connected to the port. We have to apply the sterile lubricant to the first 6 to 7 inches or 15 to 7.5 centimeters of the catheter to the drainage system. And we have to make sure that the drainage bag emptying port is being clamped. Bring the kit to the sterile field between the patient's legs. Now, in preparation of the urethral meatus, with our non-dominant hand, we have to gently grasp the shaft of the penis just below of the glans. Keep your hand in place as it's now contaminated. If uncircumcised, use the same hand to retract the foreskin. And with our sterile dominant hand, clean the meatus with the antiseptic solution. We have to swab outward in a circular motion to the base of the glans. And we have to do this 3 times. Now moving forward in inserting the catheter, we have to lift the penis with our non-dominant hand perpendicular to the patient's body. Pull up slightly on shaft and gently press both sides to help open the meatus. Ask the patient to bear down, and with our sterile dominant hand, we have to slowly insert the catheter through urethral meatus until urine flows down. Next is to hold the catheter with our non-dominant hand and use the sterile dominant hand to fully inflate the catheter balloon. Afterwards is to remove the syringe. Secure the catheter on the patient's outer thigh or the lower abdomen with securement device, or what do we call the strap or plaster. Ensure the tubing is not kinked and secure that the drainage bag to the bed is framed below the bladder level and not resting on the floor.
Now, after the procedure, I already assist the patient in his comfortable position, and now we have to dispose the used supplies and then put the syringe in a sharps container, and then afterwards is we have to remove our gloves. Now, after doing so, is we have to make sure that we perform hand hygiene. And now next, for the documentation, we have to document the type and size of the catheter and the balloon, the amount of fluid that is inserted in the balloon, the patient's reaction to the procedure, as well as the amount and the characteristics of the urine, the name of the person that is performing the insertion, and lastly, the time and the date that it was completed. So that's it. It's the end of the video. I hope that you learned something with this demonstration. Once again, this is Ruella Abuton, and thank you for watching.
I was like 16